Good morning, everyone. Thank you for joining the meeting today. I'm Omar Rababa, a research scholar at the University of Michigan. I have joined Insight in December 2019 as a research associate. Insight has worked on a project on nanoparticles hyperthermia in cooperation with the University of Kettering, and we are continuing to work on this topic. My presentation today will be about an interesting research area and an active area of research, which is the potential of magnetic hyperthermia as a therapeutic modality for glioblastoma. Why are we concerned in glioblastoma? Glioblastoma is the most common primary brain tumor in adults, and it's at the same time the most aggressive brain tumors in adults. The 5-year survival rate for this type of tumor is around 6.8%. The available treatment for glioblastoma include surgery, radiotherapy, and a chemotherapeutic agent, temozolomide. And despite all efforts that have been made, the survival rate is still low for glioblastoma. That's why scientists are looking for a new intervention, new way of treatments. It has also a poor prognosis. Hyperthermia as a treatment modality is defined as a procedure that aims to raise the temperature at tumor site, and mostly the elevation of temperature is mild, around 41 to 43 degrees Celsius. It may jump to your mind that this way of intervention and this method of treatment is a new one, but actually there are some reports that earlier used around 2000 BC, the physician at that time used hyperthermia as a treatment for cancer. In the recent history of science, studies suggested the sensitivity of cancer cells to hyperthermia. And after that, the scientists began to reveal the mechanism by which the hyperthermia affects cancer cells. And here are some of these mechanisms. First of all, hyperthermia leads to disruption of cytoskeletal structures. Hyperthermia induces DNA damage and lead to DNA repair dysfunction. Hyperthermia may lead to oxidative stress and also activation of what's called heat shock proteins. And an interesting mechanism of hyperthermia is inducing immunity. All of these things can eventually lead to cell apoptosis and death. An interesting mechanism of hyperthermia is inducing immunity. And as we know now, the most successful treatment against cancer is by enhancing the immune cells against cancer. The molecular mechanism of hyperthermia enhances anti-tumor immunity by many factors. First, by enhancing cytotoxicity, by promoting antigen presentation and maturation of immature dendritic cells. It also leads to reducing of what's called T regulatory cells in tumor tissue, increasing expression levels of adhesion molecules, enhancing the trafficking of lymphocytes, and finally, sensitizing cancer cells to immune effector cells. Type of hyperthermia that was used in cancer treatment, we have a traditional and classical method, and listed here, which is local hyperthermia, interstitial and intracavitary hyperthermia, and some scientists consider this is a part of local hyperthermia. We have a regional hyperthermia and whole body hyperthermia. Local hyperthermia, as the name implies, this method used to treat a localized area of tumor. And there are some characteristics of this intervention. First, we use a high temperature, not the commonly used, not the mild temperature. We use high temperature that's around 50 to 60 degrees Celsius. And the depth of a tumor treated in this way is limited to a few centimeters. This method is effective for local control of the disease. In interstitial and intercavitary hyperthermia, there is a small device that is placed inside the human body that emits a specific radiation that generates heat. In the interstitial type, the device implanted in some area like prostate cancer, like brain tumors may be used. In endocavitary approach, it's used for any holy organ, for example, in esophageal cancer. And this method mostly used with what's called brachytherapy, which is a form of radiotherapy in which the source of radiation is put inside the cells or inside the human body. Regional hyperthermia is divided into three intervention or three approaches. First, deep tissue, used, for example, in cervical or bladder cancer. And this method is shown here in this picture. As you see, the device encircles a specific area of the human body, and this device emits a specific wave or specific radiation, either radio wave, microwave, that generates heat in the affected area of body with tumor. Another approach is regional perfusion approach. This used, for example, in arm and legs cancer, maybe in liver cancer. And in this method, the physician withdraw blood from the patient and then heated this blood outside the body and transfuse it back to that area, to that organ. And the last one of this of regional hyperthermia is continuous hyperthermic peritoneal perfusion. This intervention used for treatment of peritoneal cancer, example like ovarian metastasis. And in this approach, the doctors are infuse inside the peritoneal a heated fluid along with a chemotherapeutic agent. The last one is what's called whole body hyperthermia. As you see here in the picture, the patient put inside a heat chamber and the temperature is raised to around 42 degrees Celsius for nearly 1 hour. This method is a palliative one that's used mainly in metastatic condition. Interestingly, that the whole body hyperthermia may be used to treat disease other than cancer, like a major depression disorder. The use of hyperthermia in a clinic is largely experimentally limited to clinical trial, either phase 1, phase 2, or maybe phase 3. But its use in clinical practice is still not that common. And some characteristics about its use, the use of hyperthermia in clinic, is that rarely to be used alone, maybe for some local cases where the radiotherapy is not allowed. But the promising approach in hyperthermia treatment is to use it in a combination with either radiotherapy or chemotherapy. And the rationale behind this is that hyperthermia may improve the blood flow to the tumor and thus improve oxygenation and drug delivery to that tumor. And also hyperthermia leads to DNA repair dysfunction, and this may make the cancer cells more susceptible to DNA damaging treatment, either chemotherapeutic or to radiation. Here at Insight, as we are interested specifically in glioblastoma, let's talk about the hyperthermia in glioblastoma and various preclinical study like either in vitro or in vivo, support and give an evidence for susceptibility of glioblastoma to hyperthermia at the clinical level. There are some clinical reports, some case series, and even clinical trials that support the hyperthermia in glioblastoma. However, just I want to emphasize that this field is still in its infancy and much research needed to be done. The combination, as we said before, as I said before, the combination with radiotherapy is a promising approach, and this exemplified by this clinical trial in which the physician recruited a 13 patients and divided them to two groups, 15 in each one. The control group, who received the standard care of treatment, which includes surgery, radiotherapy plus chemotherapy agents, and the hyperthermic group, who received the standard care of treatment plus hyperthermia. This researcher found a significant reduction in the tumor growth in the hyperthermic group, and necrosis was evidenced in 18% of the specimen. And as you see here in this table, look at the control group. After 3 months of treatment, the tumor diameter actually increased. But in the hyperthermia group, it's obvious that there was a significant reduction in the tumor diameter. The combination use of hyperthermia with radiotherapy also supported further by a preclinical study. And in this study, the scientists found that hyperthermia sensitized what's called glioma stem cells. These glioma stem cells are believed to by many scientists that mediate the tumor growth and it's resistant to treatment. So hyperthermia inhibits stem cell proliferation, glioma stem cell proliferation, and enhance their sensitivity to radiation therapy. The role of hyperthermia in glioblastoma is not limited only to treat it, but also it may enhance the drug delivery into the brain, or it may be also used as a drug carrier. An interesting article that was done on 14 patients have studied the effect of hyperthermia on the blood-brain barrier. And as we know that one of the major obstacles and challenge to deliver various drugs into the tumors in brain or other is the presence of blood-brain barrier. The scientists in this article, in this study, found a transient blood-brain barrier disruption caused by hyperthermia. And this is a very interesting finding because this can give us an opportunity to use many drugs to treat the glioblastoma, because actually we know that many drugs are effective against the glioblastoma, like in vitro, but we cannot use them in clinic simply because they cannot cross the blood-brain barrier. So by combining them with hyperthermia, this gives us an opportunity to use this drug. Also, the scientists have prepared what called thermosensitive drug carriers. These are synthesized in a manner that when are exposed to the heat, they release their contents of the drugs. So give them a potential to be used also as a drug carrier. Nanoparticle or nanomedicine is an emerging field in the science that gained attention in the recent years. Nanoparticles are structured with up to 100 nanometer in their largest dimension, and generally have some general characteristic like what's called enhanced permeability and retention effect. This is intrinsic characteristic in nanoparticle enable them to accumulate in the tumor site. The nanoparticle can be recognized by immune cells, and this may lead to their destroying or clearance. But at the same time, nanoparticle can be modified chemically or physically to protect them or to enhance their selectivity. Nanoparticles that used for hyperthermia have additional characteristics or features. They absorb electromagnetic radiation and convert the energy to heat. And they have a good conductivity, like, for example, the metallic nanoparticle. One of the nanoparticle type that used in glioblastoma is the magnetic nanoparticles. And as their name implies, these nanoparticles have magnetic properties. And when they expose to what's called electromagnetic magnetic field, they release the heat and thus raise the temperature at tumor site. The first use for magnetic nanoparticle actually was in 1957 to treat metastasis to lymph node. Interestingly, magnetic nanoparticle even provide more selective approach of tumor targeting specifically for glioblastoma. And actually, this is what scientists note in their vitro study. They found a preferential uptake of this magnetic nanoparticle with glioblastoma cells compared to normal cells. Magnetic hyperthermia and is more effective also as a source of heating than external source of heat. And actually, scientists found that at the same temperature, the magnetic nanoparticle can lead to more cancer killing to achieve their goal more effectively than external source of heat. Magnetic nanoparticles and also other nanoparticles can be delivered to their target tumor by many ways, either directly inject them into the tumor, or intracapillary injection, like in case of bladder cancer, inject them directly into cerebrospinal fluid, like in glioblastoma cases, and intraperitoneal, like for peritoneal cancer, for example, ovarian cancer, or we can inject them intra-arterially, like in case of liver cancer. The third way, which is the most common way for any drug, is the intravenous administration, and this may be used for most cancer. And the last one that used more specifically to brain tumor and interesting approach is called convention enhanced delivery. And in this method, a tip or a catheter is placed in the interstitial or brain parenchyma, and then the drug delivered directly to the brain, bypass the blood-brain barrier. The drug delivered over even several hours. Several in vitro and in vivo studies provided a compelling evidence for the effectiveness of this modality for using magnetic nanoparticle inducing hyperthermia in glioblastoma. The first study was done maybe 2 decades ago. And as you see here, this was the first done that showed the feasibility of use magnetic hyperthermia to treat glioblastoma. It was done in 1996. And as you see here, obviously, we have 2 groups of cells. The first group, the control group, that was received no treatment. And this group of cells received the magnetic nanoparticle and exposed them to magnetic field. And it's clearly obvious that the number of viable cells was decreased in the treatment group. And this was correlated with magnetic field intensity to a degree that when we expose these cells to 300 magnetic field, no cell was viable. And this in vitro study further supported by in vivo study in which the researchers studied the effect of magnetic nanoparticle on transplanted glioma tumor in mice. And temperature elevation was achieved at tumor size in all mice, and complete regression was achieved in nearly 87% in one of the treated group of the mice. And look here at this nice picture. This the A picture is from the control group who received no treatment. And as you see, there's an obvious large size of tumor. Whereas this in the P picture, you see that nearly there is no tumor, and this is actually the one who treated with magnetic nanoparticle. Another study was also done and further supported this finding. And in this study, the scientists found that magnetic nanoparticle can lead nearly to 4.5 prolongation of survival. And imagine it's nearly 5 times prolongation of survival was noted in the treatment group compared to the control group. And other researchers tried to find some mechanism beyond this amazing prolongation of survival, and they found that the hyperthermia can activate also the anti-tumor, anti-glioblastoma immunity, which was long-lasting also. Magnetic nanoparticle also can be used as drug delivery system. We can load them with specific type of drugs, either chemotherapeutic agent, antibody, gene silencing mechanism, and any kind. And when expose them to alternating magnetic field, they can release their contents of a drug at the tumor size. And this can protect. This has many advantages, like can protect the chemotherapeutic agent, can provide a selective delivery of this drug to the tumor site. And even more interestingly, that magnetic nanoparticle can be used as a hybrid system. And in this system, we can use them as both treatment and drug delivery. For example, scientists prepare what's called supramagnetic iron oxide nanoparticle, which is a form of magnetic nanoparticle, and loaded them with a non-chemotherapeutic agent called doxorubicin. So when they expose this magnetic nanoparticle to alternating magnetic field, first they generate heat. So this leads to elevation of temperature, of cancer cell temperature, and at the same time, they release their content of chemotherapeutic drug doxorubicin. And the effect was synergistic effect, has a more powerful, a more effective in killing cancer cells than a traditional approach. Scientists always aim to provide a more selective targeting of tumor as much as they can. Their dream is to provide, which is also the ideal drug, is that one that selectively, completely targets the tumor cells with and reducing as much as they can side effect on the normal cell. So to achieve this, they modified the nanoparticle or the magnetic nanoparticle by adding some antibody or some molecules that recognize tumor cells, and this leads to more selectivity toward tumor and efficacy, and as I said before, reducing side effect and unwanted normal tissue targeting. In clinical practice, the use of magnetic nanoparticles are still limited despite all promising preclinical study, and is maybe limited to 3 or 4 clinical trials. The earlier study was done, an early study was done on 14 patients just to test its safety mainly. And it was done in combination with radiotherapy and show it was effective, safe, and side effects were manageable. Another combination study which further support the promising approach of magnetic nanoparticle inducing hyperthermia with radiotherapy was done on a 66 patients with recurrent glioblastoma. The researcher observed a longer survival rate after tumor recurrence were achieved in those who received hyperthermia. Even the radiation dose was reduced for that group. As any drug, as any interventional method that will enter clinical practice, the safety is a priority. And actually, many ongoing research and many research needed again to be done to test the toxicity, to test the safety of magnetic nanoparticle. And one study done on a specific type of nanoparticle found that most side effects were mild to moderate, like mild back pain, pruritus, headache, and severe side effect. Even it was noted, but actually it was very rare. These included like anaphylactic shock, chest pain, dyspnea, severe skin rash, or decreasing of oxygen saturation, and hypotension. But as I said, many research, further study should be done because there is a various way there is a various preparation of the magnetic nanoparticle, and even any chemical or physical difference can affect their effectiveness and their toxicity. When treated someone with a nanoparticle, some precautions are needed. So, if, for example, if the patient have any metallic material inside it that may affect by magnetic field should be removed, like dental implants, crown, anything that affected by magnetic field. The pacemaker and defibrillation is a contraindication for magnetic nanoparticle. As any new method or interventional treatment, many challenges and drawbacks face the magnetic nanoparticle. For example, we cannot use MRI as a tumor response monitor after injecting the magnetic nanoparticle. There also are some change in the preparation of magnetic nanoparticle. We need to achieve optimize the heat. The heat should be homogeneous, that reach every cancer cells, not heterogeneous. Should not be excessive heat because we do not need to affect normal tissue, and should reach its target, which is the tumor of interest. Just finally, let's summarize everything I said. Hyperthermia is a promising treatment modality to be used in glioblastoma and other types. And the promising approach of hyperthermia is to use them in a combination with either chemo or radiotherapy. Targeted magnetic nanoparticle provide a newly interesting approach to achieve more selective and more effective hyperthermic treatment with much fewer side effects than the traditional hyperthermia treatment. And finally, hyperthermia use is not limited to treatment alone, but it may extend it to drug delivery and its hybrid use, like both drug delivery and treatment and at the same time. Thank you for hearing me, and if there is any question.
So does anyone have any questions or follow up on the presentation.
Hi there. Great talk. I just wanted to talk a little bit about that article you mentioned that looked at the use of heat therapy in gliomas, especially GBMs, and the differences in sizes of tumor compared to controls. Just wondering, did they also look at the genetic profiles of those GBMs? Because, you know, some tumors are more susceptible to radiation therapy in general. So was that, you know, accounted for as part of their confounding effects?
Great question. Yeah, they didn't test the genetic profile in that study, but they recruited the patient blindly, so we don't know. I know this is maybe a small study. That's why a larger study should be done in the clinical type. But actually, in their study, they didn't test the genetic profile for the patient in their study.
And have you learned a little bit about, so there's laser interstitial thermal therapy, which is used for, you know, a lot of different tumors, radiation necrosis, gliomas, you know, tumors that are in hard to reach locations, things like this. And, you know, there have been a lot of good studies over time that have shown that this has been effective for these tumors in terms of reducing tumor size and all of that. So the idea of, you know, nanoparticles and the convection thermal therapy delivery is exciting because it kind of fits and goes in the same direction of laser thermal therapy. So it would be good to kind of look and see what the connection between the two is, and learning from the mistakes from laser thermal therapy and its application in actual patients. And see if you can kind of transfer that to the nanoparticle story.
I see. Actually, it could be, yeah, it's worth it to look further at for these things, to try to combine them maybe also as a potential treatment. But maybe don't know how exactly you can benefit from them, because the physical characteristic of magnetic nanoparticle is that these, when are applied, when exposed to alternating magnetic field, where is the source of heat generation in the laser therapy is laser, and in other some radio frequency ablation method is a radio wave. So I'm not sure how exactly we can connect them, but it's worth it to look to dig deep further in the study, and maybe it need to more need help from one who expert in the physics field in this or biophysics that way.
Can you see the question on the chat?
Yeah, let me see. Yeah, thank you for your question. Question about when hyperthermia is applied to nearby normal tissue will be affected, and what could happen to normal tissue in your experiments. Yeah, definitely. Any cells could be affected by heat. There's a normal response of cells. What the science found that many cancer cells are maybe more sensitive to cancer cells, and that's why in some of, maybe we didn't explain it in this method, but scientists have different ways to use the side effect and the direct effect of temperature on the normal cells. And if you see here, for example, I don't, maybe in the local hyperthermia, in this one, the scientists in the local hyperthermia, as you see, there is what's called here a water pulse. This one is like to transmit heat or to at the same time to reduce the direct effect of heat on the normal tissue. But yeah, there will be an effect, a side effect on normal tissue. But as any treatment, there is no treatment without side effect. This is impossible. But the ultimate goal of any intervention is that the benefit should outweigh the risk. What will happen to normal tissue in our experiments, we cannot say that there will not be any side effect in normal tissue, especially still it is in preclinical study. But generally speaking, the use of nanoparticle or targeted therapy is associated with much less side effect than the use of untargeted or the unspecific therapy. So if you use the traditional way of heating, either regional or local hyperthermia, you provide a non-specific approach. Whereas in the case of the magnetic nanoparticle, you have the opportunity to what's called a specific approaching in the treatment of cancer, or the targeted approach. And this, in many studies, not necessarily magnetic nanoparticle, but in other, they use, for example, the targeted antibody in the cancer treatment was associated with much less side effect. So definitely there will be a lower side effect, or not definitely, to our knowledge, it is theoretically there will be a much less side effect in our experiments, but we cannot say that there will be no side effect until we see at least in human.
Just to add a little bit to that, so some knowledge from the laser therapy session of things is that, you know, the heat that you apply does spread to the tissue around where you're treating up to about 1 to 2 centimeters sometimes. And then the other thing to consider is you can kind of develop heat sinks in different areas of the brain. So for example, water acts as a heat sink. So if you have a lesion that's close to the ventricles or close to large vessels, you're not able to really get as much high enough of a temperature to treat as you would like, because those areas act as heat sinks.
Yeah, that's true. And there's a therapy used in glioblastoma, and also there is a radio frequency ablation also used in other tumor like liver cancer, or in other condition like some blood vessel abnormality condition. But definitely there will be a side effect. But with the aim of magnetic nanoparticle or target magnetic particle, just to more clarify, is that in any cancer cells, because their cancer cells are abnormal cells, so they may express a specific protein. They may have general characteristics that not present in human cells. And this what the scientists try to use when they develop a targeted magnetic nanoparticle. They try to figure out what is present in a tumor and not present in normal cell, or what it is expressed or present in high level in tumor and present in low level in normal cells. So, and synthesize these nanoparticles based on this biological knowledge. And theoretically, this nanoparticle will target the tumor, but no one can guarantee this 100%. Is there any further question?
Doesn't look like there's any other questions.
Mhm.
Thank you so much for presenting to us this morning and taking your time out of your day. We appreciate it.
Yeah, thank you.
This will be up on the website with the other grand round lectures.
Thank you, and thank you everyone for joining this meeting. And thank you for your questions also.